Welcome to the annual Arizona Heat Kickoff. This event has evolved over the years into a streamlined statewide webinar designed to align our efforts before the active heat season begins. While our fall summit focuses on long-term strategy, today is about readiness. We have a few things on the agenda. So first we'll go over some housekeeping, then we'll have some opening remarks, followed by a weather outlook from NOAA and state agency updates from ADHS, and then we'll hear from partners and community organization, community partners as well. And then finally, we'll have some final remarks by Taylor and Eugene here at ADHS. All right, next slide, please. All right, so just of note, this event is being recorded. Participants are going to be muted on entry, and please remain muted and keep your cameras off if you're not the speaker, just to reduce any kind of disturbances. And also for those with slower internet, not having all the cameras on kind of helps. Please submit your questions using the Q&A feature. We will do our best to answer them during the event, but there may be some time limitations, so we will be sharing the questions and any answers after the event as well. So you can find all this on Roundtable. And then the presentation slides and recordings will be posted on actually our Arizona Heat Preparedness events page. So that's our website. We'll give that link at the end. All right, next slide, please. All right, so those of you who aren't used to Zoom, here's a quick tutorial. You'll find your mute and unmute, your video start stop on the bottom left. There's options to check out who's in attendance and to send chats. And then if you want to react to things along the way, there's also a button for that. So next slide, please. All right, so first up, we have Reverend Katie Sexton with the Arizona Faith Network to give us some opening remarks. Katie, are you on the call?
I'm here. Thank you. Thank you. Well, good morning, everyone, and welcome to the 2026 Heat Kickoff for the state of Arizona. On behalf of the Arizona Faith Network, I am honored to be with you today, to be with people who choose again and again to show up in the face of our greatest challenge in Arizona, extreme heat. Extreme heat is a force we know that has taken many lives. And behind every statistic, there is a name, a face, a story, a person who was loved, who mattered, who should still be here. And what we do as hundreds and hundreds of people, what each of you does every year matters in ways that are profound and life-saving. Our work is not abstract, it's not optional, and it's not secondary. Our work in heat relief is the difference between life and death, between isolation and connection, between despair and hope. And what, in the face of all of that reality, what I see across Arizona is extraordinary. I see people and businesses and congregations and nonprofits opening their doors in the hottest months of the year, not just as hydration and cooling centers, but as places of welcome, rest, and belonging. I see community partners working together in deeper ways. I see cross-collaboration of people choosing compassion over pride and indifference. And that is what brings us here today. This is our collective effort across sectors, across traditions, across communities to respond with clarity, coordination, and care. At the core, our work is about something simple and profound. Our belief that every person deserves to be safe, every person deserves dignity, and that no one should be left to face this extreme heat alone. And so before we start today and before we move forward to all the data and predictions, I want to invite us to pause together as an act of remembrance. Wherever you come from, whatever you believe, or if you simply believe in the quiet truth of humanity, let's take a moment to remember those who have died from extreme heat, to hold the grief of families and communities who carry that loss, and to take a breath to center ourselves in the dignity and worth of every single life we will serve this season. Let us pause for a moment of silence. May every person's memory be a blessing. And as we begin our work today, may we carry both remembrance and resolve. May we honor those we have lost with our words and our actions. And may we continue building a community where care is the rule and the expectation. Thank you for being here. Thank you for the lives you are helping to protect. And let us begin. Thank you.
All right, thank you, Reverend Sexton. Taylor, next slide, please. Okay, here we go. Next up, we have Tom Frieders with the National Weather Service. Tom, are you on? Great. And
yep, good morning, everybody. I think try to share my screen here. All right, should be seeing my screen there. So, yeah, good morning, everybody. Tom Frieders, I'm the warning coordination meteorologist with the National Weather Service in Phoenix. What I'm going to focus on in the next 15, 20 minutes or so is just kind of all the different resources that are available from our National Weather Service offices to help you in your heat response programs that are out there. So, and then I'll finish off. Everybody wants to know what correlation there is with that March heat and how does that correlate with our projections for the summer. I'll go into that to finish things off. So just to start things off, just to kind of give everybody some background, many of you probably already know this, but as we progress through this presentation, a lot of the focus that I'm going to have will be some of the information out of Phoenix, but it's related to the entire state. All the programs are the same. So if you are unfamiliar with our various National Weather Service areas, this map can kind of show you we have 4 offices that serve the state of Arizona, from Las Vegas in the northwest, Flagstaff in the northeast, and our office in Phoenix covers much of the central and southwest part of the state, and then Tucson covers southeast Arizona. So keep that in mind when you're navigating websites and things like that for related weather and climate information. So let's dig right into it with resources that we utilize in the National Weather Service for the extreme heat program. The main thing, and I think most of you have heard us talk about this, but it's just a good reminder of the use of heat risk. Back in the past, and still a lot in the more humid climates in the Midwest and East, they use the heat index, which is kind of a feel-like temperature when you combine actual temperatures with humidity. But in the West out here with the dry air mass, we have transitioned to the use of heat risk. And heat risk is a value for any given location across the CONUS. If you go to that website at the top, it's a national CONUS map, and then you can zoom into your local area for the details for the heat risk for your specific location. So it is location dependent, and it calculates heat risk based on how unusual the heat is for any time of year. So it's going to change based on the time of the year it is. Duration of the heat, it includes both daytime and nighttime temperatures. And then if those temperatures pose an elevated risk for heat-related impacts, and we also incorporate mortality information from the CDC database. So all that goes into calculating these heat risk categories, 0 in that green category, little to no risk. And then it goes up the scale, becomes moderate once you hit the category 2 in the orange. And then red and magenta is the most extreme. We call it the major and extreme heat risk levels. And these levels both complement and are the main driver for our extreme heat watches and warnings. So whenever you see an extreme heat watch and warning issued by one of your National Weather Service offices, more often than not, your location will be in that major, that red category of heat risk, or that extreme magenta category. And those are basically those categories that heat impacts all of us. Where some of the lower categories, there may be heat related impacts for those sensitive to heat. But once you get into that red and magenta, if proper precautions aren't taken, adequate hydration, cooling, it can affect anybody and can become life threatening. So just there's a lot of information here, but just kind of focusing on the chart in the middle, and you can kind of see, I just picked Phoenix, but up on that website up at the top there, you can go to that location and click on the location near your spot, and you can see a similar chart. But just taking Phoenix, for instance, we highlight those different heat risk levels. So the yellow, minor, orange level, moderate, red level, major. And then if you're kind of off the chart here with above record levels, then you get into that magenta color. But the yellow is categorized by CDC minimum mortality temperature. So nearly all heat attributed deaths occur above this temperature. And we all know in our business, when we're talking about heat, that even as low as in the 80s, we can start to see impacts again, especially to those sensitive groups. So just because we're not in an extreme heat warning doesn't mean there's not a risk out there. And I think everybody on this call kind of understands that. And then once we get into the moderate category, now we have hit that point where any temperatures above that category is attributed to about 70% of all heat related deaths. And then above the magenta, about 50% of heat related deaths occur. So it's above this red level is where, again, we focus in on our extreme heat watches and warnings. And one thing to note here, so when you start here, kind of on the right here in October, all the way through early May, you can kind of see these lines are kind of leveled off there. And we'll focus in on this major category. So for instance, for Phoenix, this major category is 105 degrees. So any temperatures at or above 105 degrees that are forecast, we're getting into that major heat risk. Again, that heat that can impact any of us. But then we also do this stair step approach. Once we get deeper into the heat season, we utilize higher levels of heat risk as the climatological normals continue to increase and peak. And say, for instance, Phoenix, again, we peak at about 107 for a normal high temperature in late June, early July. So if we were going to issue extreme heat warning at 105, we'd have a heat warning out the whole summer. So we do account for acclimation to the heat as the heat season progresses. And so while what we saw here in March, we had an extreme heat warning out for 105 degree temperatures. By the time we get into late June and early July, it's going to take temperatures right around or above 114 degrees. And so that's when you start to get into the more extreme levels and near record level heat. So sometimes people are confused on that because they think you're going to just choose one threshold for the temperature, extreme heat temperature, but we don't do that. And that's why the timing of the extreme heat warnings differ depending on the time of year. And then also on the way down, we do a stair step approach downward as we progress into the fall back to that 105 degree once we get to October. So in a couple of years ago, we had that extreme unprecedented heat in October. So we saw some late season extreme heat warnings. So that's how that works. And there's a lot of additional information on our heat risk website. Something new that experimental that I haven't shared too much with hardly anybody because this was actually just released by our agency this morning. So it's hot off the presses, and we're working to produce probabilistic heat risk. So while some of the numbers I just showed, it's going to be a today's heat risk is this value, the tomorrow's is that value. But there's always a probability that, hey, we're forecasting moderate heat risk tomorrow, but there may be a slight chance, 20, 30% chance we could be in the major heat risk category. And we want to let people know that. And so this is a new probabilistic heat risk map that can hopefully help all of you in the heat response programs to get a feel for, what the confidence level is for each of these heat risk levels. So this is just and we'll talk more about this as we go through the heat season. We're going to continue to advertise this with all of you, but you can certainly go to that website up there, click on that, and click around and experiment with what you can find on the page and how maybe you can utilize that in your programs. This is a map of the United States, which the spatial distribution of the various heat risks. So if I was on the website, I could click on extreme or major. In this one example, I have it clicked on moderate heat risk. So this map is showing the probabilities of moderate heat risk for this particular day with the proper probabilities there in this chart in the lower right. So if, for instance, this day, you would say that you're probably close to 100% chance that Phoenix is going to be in a moderate heat risk, or all of Southwest Arizona. Then further on, you can actually click on your location and you'll get some charts that you can you'd actually be able to mouse over that would give you the probabilities of all the different heat risk levels for any particular day in the next 7 to 10 days. So hopefully it'll be a real handy tool out there. And there's also then a toggle button. You can change it from this type of a graph to a line graph down at the bottom too, and see the probabilities, whichever you see more helpful. And then there's actually a forecast with the actual values down at the bottom. So pretty excited about this page, and we hope you can click around, experiment with it. Down in the lower left, you don't see it on this chart here, but down the lower left of the website, there is a feedback button, and we'd love to hear your feedback through the website, or you can contact one of us serving offices and let us know how it may help your programs. So since we've already been in some pretty extreme heat, we all know what March turned into. And this is on everybody's mind. So I thought I'd just do a quick recap. Again, a focus on Phoenix, but this was an impact all across the Southwest U.S. with considerable, I'll use that unprecedented word, unprecedented heat for late March, breaking records. This is a climate chart for the month of March for Phoenix. And everywhere you see this magenta triangle, these are record highs on the top here. So we had, in Phoenix specific, we had 14 record highs. So almost half the days in March, we had record high temperatures, but especially focused for the second half of March. And with 3 days at 105 degrees, to put that into perspective, in Phoenix, we had our record, we hadn't seen a high of 105 degrees occur. And in fact, 105 degree temperature is an all-time record high temperature for the month of April, but we were only in March, and it occurred 3 times. And then otherwise, it's only occurred twice in the month of April. So that's how unusual this event was. And subsequently, it resulted in the earliest extreme heat watches and warnings for much of the lower deserts across the Southwest during this late March timeframe. That upper right chart there, 70 on average, 78.8 degrees was the Phoenix temperature for the month of March, and that broke the record from 2004, which was 72.3 degrees. So over 6 degrees above the record, and that's just incredible. So during that heat, I thought I'd kind of share this because it was different. It wasn't a typical heat wave of 105 degrees in May or June when we're starting to get used to it. Hey, this is what we expect for this time of the year. It was only March. So we did have to kind of change our messaging. We had a lot of media interviews, and on our website and social media, we did work to kind of change our messaging to more talk about escalating temperatures quickly during the mid to late morning hours, because you were going outside, people were going outside in the early morning hours. It was in the 60s and 70s, felt cool, but boy, that heat escalated quickly in the morning. And then we were hearing a lot of rescues on trails and things like that, and impacts on outdoor events, because this overlapped our outdoor event season here in Arizona too. So that was another thing to consider. And also, if you did follow this, many times the map was only showing a moderate heat risk because of the cool temperatures in the morning, but it was that afternoon high temperature around 105 that was in that major category. So it was more of a short duration daily thing during the late mornings through the afternoon hours, where it wasn't the typical extreme heat in July where your temperatures are hot at sunrise as well. So we definitely had to change our messaging. Information, thanks to the Maricopa County Department of Public Health, I got a little bit of information on impacts. The percentage of heat illness response for that March heat wave, we did see a pretty good spike for heat-related illnesses. Some of the values I saw, are comparable to some of the spikes that we get into the middle of the heat season. So it was definitely an impact. We were also supporting weather information. A lot of you probably heard about the Luke Air Force Base Air Show with about 400 heat illnesses treated and 25 hospitalized. So we did have concerns about that leading into the event, and this was an example of our briefing 3 days ahead of the event, where we did again change our messaging to really talk about that heat escalating quickly during the morning and early afternoon hours, just to get that awareness out that hey, it's going to be nice in the morning, but it's going to be bad by the time you get later in the day. And just a reminder on our watch warning program. So remember, it is extreme heat watch warnings. So if you have preparedness plans out there that mention anything about excessive heat, we can help you get those updated. We changed the terminology last year, but a watch is kind of, again, that heads up that extreme heat could be moving into the area. Our guidance is showing that there's a strong possibility of this, but we're not definite as of this moment. So typically these are going to be anywhere from 4, 5, 6, 7 to 10 days out that we'll issue this watch, depending on our certainty of this event. And then once we get closer, once we pretty much know it's going to happen, it's imminent or it's already occurring, that's when you get the warning issued, and that's when we want people to be taking action and put those preparedness plans into motion. So watch, kind of a heads up. Warning is now to take action. And when you get into other monsoon seasons events like thunderstorms and flash flooding and things, the terminology is the same. So just to be aware of that. And resources, we'll be sharing these slides, so you don't have to quickly jot all these down. But web page, we also have a nice heat resource page off of our Phoenix website page, but you can click on that and get all kinds of information, including probabilistic information on various temperature levels if you're concerned with temperature levels. How long is the heat going to last, or when's it going to approach? We have Climate Prediction Center outlooks that go 8 to 14 days out. Also seasonal, which I'll talk here in a little bit. Follow our social media. And then if you don't get our daily email briefings or any email briefings from any of our offices and would like to be part of our distribution list, you can sign up at that website down at the bottom, and we kind of send out these heads up emails of high impact weather coming in, which includes the heat. So everybody wants to know, what's the outlook look like? Does that March heat correlate to an extreme heat for the summer season? Not necessarily. There's no correlation there. However, our outlooks, this is kind of a 3-month rolling outlook from April, May, June on the left there, all the way to July, August, and September on the right. You can see on the top there are lots of shades of oranges all the way across the board. So that's trends toward higher probabilities of above normal temperatures. So not seeing a whole lot of change there. I'd love to report out one time where we have projections of below normal temperatures for seasonal outlooks, but we're just not seeing it through this summer. However, if you do look at the bottom charts here, this is precipitation outlooks. And you probably have heard about El Nino developing for later this by this fall and into the winter, next winter. But that could correlate to a little bit more of an active monsoon, maybe some more tropical moisture feeding up into the southwest. And if you get more thunderstorms, more precipitation, that'll tend to bring those temperatures down a little bit. So I'm hopeful that by the time we get into the monsoon season of July, August, and September, we'll see a little bit more in the way of clouds and precipitation and to bring those temperatures down a little bit. Hopefully we can avoid some of these record years that we've seen in the past 5 or 6 years or so. And I just want to say thanks to all the collaborating agencies to work on our Heat Awareness Week campaign that's coming up on May 4th through the 8th. We've got the governor's proclamation for that for Arizona. This is just an incredible collaborative effort between so many agencies and organizations, and we really appreciate the support in that, which I think we all do on the call, and so we can get our messaging out throughout the first week, that first full week of May. So that's all I have. I'll stop here just briefly again on our service location map for the different National Weather Service offices. On the maps, there are our administrative contacts if you had any administrative type questions. But if you want 24/7 access to our offices and meteorologists, jot those phone numbers down there and give us a call, whether it's 4 a.m. or 4 p.m. if you have any questions or concerns about any of the weather. With that, I'll hand that back off to Jennifer, maybe. Thanks, everyone.
All right. Thank you, Tom. As Taylor's getting the slides back up, our next speaker is Dr. Eugene LeVar with the Arizona Department of Health Services. I'll hand it to you, Eugene.
Okay, thank you, Jenny. We'll get the slides up here. Here we go. Hopefully everybody can hear me. Good morning, everyone. I wanted to give a brief update from the ADHS end. And our focus this year is moving from planning to action by leveraging data, innovation, and collaborations for continued resilience across the state. Next slide, please. We'll go to the next one. So the 2006 HEAT report, which is titled Updated Strategies and Approaches, is coming soon. It'll be posted on our HEAT preparedness page and serves as a comprehensive update to our 2024 plan. This document summarizes community input from our recent HEAT summit and details the progress we've made on our 4 core goals. So we're very excited that this will be posted soon, and we'll be sure to share that with our partners as soon as it does. Next slide, please. Looking at the data, there is cause for cautious optimism. For the second consecutive year, we're seeing a decline in heat-related deaths in Arizona. After peaking at 990 in 2023, preliminary 2025 data show a drop to 667 deaths in Arizona. While this trend is positive, our work continues since each and every heat-related death is preventable. But that is definitely some good news. Next slide, please. Our data reminds us that heat is a year-round threat in Arizona. While July remains the deadliest month by far, with over 2,200 deaths recorded in that month alone over the last decade, we see heat-related fatalities outside of our regular heat season. This definitely reminds us that heat awareness and prevention are a year-round mindset in our state. Next slide, please. An encouraging data point is that 2025 marked the first decline in heat-related illness emergency department visits since 2020. Preliminary figures show a drop from nearly 5,300 visits in 2024 to about 4,800 visits in 2025. We hope this trend continues moving forward into 2026. Next slide, please. To keep this momentum and make sound decisions, we need real-time data. On May 1st, our 2026 heat-related illness dashboard goes live. We wanted to highlight a few improvements to the dashboard since our last year's kickoff meeting. These include a new heat-related deaths tab And ADHS has reduced the syndromic data lag from 2 weeks to every Monday, Wednesday, and Friday during the heat season. So hopefully these will be useful real-time tools that our partners can utilize throughout heat season for awareness in their jurisdictions. Next slide, please. Our Capital Mall solar-powered cooltainers are back for 2026 in partnership with the Governor's Office, the Arizona Department of Administration, and the Arizona Faith Network. The site at 1601 West Jefferson Street opened on April 20th and already saw visitors taking advantage of that cooling site. And the second location at 1818 West Adams Street will open on May 4th. These units provide a welcoming, low barrier, and immediate relief in these high traffic, high need areas. And wanted to give a reminder that our state heat relief site map goes live on May 1st. And you can access it through the QR code you see here. Next slide, please. A motto we commonly use is to stay cool, hydrated, and informed. A good way to stay informed is to sign up for ADHS heat alerts, and you can access them through the QR code on this slide. We provide National Weather Service warnings that Tom just went over directly to your inbox or by text message. And new for 2026, we're offering these alerts in Spanish. And the alerts will include some expanded guidance that you see here covering heat and medication precautions, hydration guidance, and battery and device care. Next slide, please. We've updated our heat.az.gov, which is our central heat resource hub that we utilize here at ADHS and for the state. This is a one-stop digital portal designed to connect agencies and help residents navigate available resources, including a new Check Your Heat Risk tool that has been included into the website. Get to know the resources now to help make good heat decisions before heat season is in full swing. Next slide, please. Collaboration is one of our state's greatest strengths, and our heat season state heat briefings start again on May 7th at 3 p.m. And those will continue every first and third Thursday through September. You'll see a link to a form pop up in the chat to join these state heat briefings if you wish to do so. We'd love to have partners join and help us have the collective input on how we're moving forward throughout heat season. And we also encourage you to join the Extreme Heat Preparedness Network on Civic Roundtable to share resources and connect with other heat partners in real time. Next slide, please. Finally, we have a suite of toolkits available that will be expanding in 2026. These include practical resources like urine hydration charts and sunscreen selection tips, and many are available in English and Spanish. These will be included with the slides that get distributed with easy to access links so you can see those different tools and resources that are available to utilize throughout heat season. Next slide, please. I'd just like to say thank you, everyone, for your interest and dedication to protecting Arizona. You can reach our team at azheat@azdhs.gov or find all these tools through our central hub website that was mentioned, heat.az.gov. Let's work together to spread the message and make a difference this heat season. Thanks, everyone.
All right. Thank you, Eugene. As a reminder, if you guys have questions, you can submit that in chat or the Q&A button. Our next speaker is Cheryl Steinberg with the Arizona Governor's Office of Resiliency. Is Cheryl on?
I turned my camera on and my audio, but I don't know if you can hear or see me.
We can hear you, and I can see you.
There I am. Okay. Okay, great. So I will share screen. Oh, I cannot share screen. Okay. Okay. All right. Everybody can see it?
Yes, we can see your screen.
Okay, awesome. All right. So hello, my name is Cheryl Steinberg. I'm the Community Outreach Coordinator and Tribal Liaison for the Governor's Office of Resiliency. So The program I'll be talking about today within our office is Efficiency Arizona. It's to help with energy bills at the same time putting less strain on the grid system. So I will get more into it. So in this presentation, I'll talk about what our office does, about the program, the appliances, eligibility requirements, the process of applying and getting the project done, and then a little information about the application information that will be required. So the Governor's Office of Resiliency was established in 2023 by Governor Katie Hobbs. The focus areas is climate adaptation and mitigation, clean energy economy, water supply protection, healthy forests and land, access to recreation, transportation, and infrastructure investment. We're a federally funded office, so we administer programs throughout the state, and collaborate locally, but also nationally. So Efficiency Arizona, it is the name that we have chosen for the home energy rebates, where homeowners can get up to $14,000 per household in rebates for products. So we will go more into that. So these are the products here. You can get a heat pump. Heat pumps are for both space heating and space cooling. You can get a heat pump water heater, an electric stove, cooktop range, or oven, a heat pump for drying clothes, insulation, air sealing, ventilation, so weatherization of the home, and an electric load service center. So as you see here, there's different prices, but it's up to. So when folks are applying, when homeowners are applying, um, it will be whatever the contractor that is assigned deems is necessary for their house or could be used in the house, and that will be the combo that homeowners will get. So the process is the homeowner submits an application, the Efficiency Arizona team determines eligibility. There is an assessment done with the homeowner with a contractor that is assigned, and then there's an agreement. The homeowner pays the contractor directly. There are two options, but the most straightforward one is working straight through a contractor, but we can get more into the other option later if you wanted to do do it yourself. But what happens is, excuse me, what happens is that the homeowner pays the difference of what the rebates didn't cover, if that is the case, but it's all through the contractor. So the contractor completes the work, and then there is a post inspection. So when it comes to eligibility, it's either going to be a 50% coverage for the energy products, or it's going to be 100% coverage. So those are determined based on the area median income of the homeowner and where they live, and then the number of residents in the home and the total household income. So here is the AMI chart, the area median chart. So here we have the different counties and metropolitan areas, and also like cities within those areas fall into this chart. And so that's how you can see. Oh, this is from 2025, but it says effective 2025. So we're always updating, and this will be on the website as well. And we're always updating the website, so the information is always fresh. The required documentation would be proof of income, identity, the residency documents, proof of home ownership, information about like utilities, the household information, like who is living in the house, and their ages. And then if there's any special circumstances, if they're seniors, disabled, or have veteran status. There's also categorical eligibility. So that means that if folks are a part of any of these programs, they're automatically eligible, and they would have to provide up-to-date valid documentation to show that they are automatically eligible for Efficiency Arizona. So this is our website that we have. So it is in English and in Spanish at this current time. you can go onto the website and you can see if you're eligible. There's a little widget that will ask you some questions that you can answer quickly. If you are eligible, you can start your application process there. And you want to try to follow up within a few weeks. Otherwise, sometimes it can get pushed to the back. But either way, you can get your application started. It takes about 10 to 15 minutes. And we've recently added a contractor map, so you can look at who are the contractors in your area. You can also scroll through and select if you prefer a contractor. The goal is we also want to keep money local. We want folks to have people that are working in their homes that understand uh, where they live, that have an understanding of the dynamic, right? So contractors will travel for projects, of course, but it is better to have um, everything local so that we're supporting local economies as well. So as I mentioned, the application itself is actually pretty quick. If you have all your documentation ready, it's just quick to upload and answer questions and put details. Um, And you will have your own login as well. So you'll want to make sure that you have um, all your windows ready with your email open and everything. And so we have some really positive testimonials so far. I'll just read them out loud to you. So my 17-year-old HVAC system was getting a little long in the tooth. So when the state finally got our HERE program implemented, HERE program is now called Efficiency Arizona. I jumped at it. It went quick and easy. It saved me $10,000, and for the last 2 months, it saved me about 65% on my monthly utilities tab. So that was Garth from Buckeye, Arizona. Next one is I am so grateful for the new heat pump I have in my home. I had a 21-year-old unit, and each summer I kept hoping it wouldn't go out. As someone who is on a fixed limited income, I need this program to complete more energy efficiency work on my home. So that was Ben from Santan Valley, Arizona. And last one is at the risk of being a little dramatic, your efforts and program feel life-changing and hope planting. I am not awaiting that giant monster disaster that seemed ever looming. Efficiency Arizona has given me a path and peace of mind that was not available previously. So thank you, Ed from Tucson, Arizona. And we have many other testimonials as well, and we're always working with our community partners as well to see how we can get testimonies across the state. It's also really important for us to understand localities and how different parts of the state have different relationships with the program itself and how there's different types of impacts. And so, yeah, I kind of skimmed through, but I wanted to leave time for questions in case there were any questions in the chat. I can. Oh, I will stop sharing and see if yes. So thank you for Travis in the chat. So the good thing about Efficiency Arizona, like many programs across the state, is that you can layer it with other programs and mix and match. The goal is for everyone to have their energy needs met. No one should be turning off their AC because they're scared of bills. We don't want anyone putting themselves in that danger due to economic reasons. And so we are collaborating across the state, across municipalities and different resources to mix and match with other programs. But we also don't want to get confused with other programs. So yes. And thank you for the next question. So unfortunately at this time, we're currently developing multifamily renters section of the program. We're building out the program as fast as we can. We want to get these dollars out as fast as we can. Currently, we've gotten over $3.5 million out in rebates in Arizona. However, we still feel like we have a ways to go. We have until the money runs out. So we recognize that a lot of renters are significantly energy burdened and don't have the ability to change out the apparatuses in the house. So we're working on developing that part of the program so that renters can also take part. Currently, the homeowner needs to live in the home. We also recognize that there are a lot of cases where maybe the home is owned by a family member that doesn't live in the home, but it's family members that live in the home. So we're always working out different dynamics, and we are more than happy to receive any calls, questions, emails to our office. I'll put my information down below, but we also have rebate managers and other folks that focus primarily on Efficiency Arizona. And if anything does come up, we are regularly meeting weekly to see how we can make the program better. So if there's no more questions, I will wrap up. Thank you all so much.
All right.
Daryl, I do have a question. I put it in the chat a couple times. Is this program open to mobile manufactured homeowners or just the standard homeowner?
I am so sorry that I missed that. Mobile homes, yes, it is accessible to for those with mobile homes as well. Because that is like one of the highest needs as well, due to the burden you see the burden is different when it comes to energy. So yeah, we have that as well.
Right. Thank you so much, Sherry.
Thank you. Oh, Cheryl.
Sorry, Cheryl. Okay.
No worries.
Sorry. Okay. Next up, we have Charles Carpenter with the Industrial Commission of Arizona.
All right. Good morning, everyone. I'm trying to share my screen real quick. Somebody else, can I get to, okay. It won't let me share my screen right now.
Okay, give us
There
a
we
second.
go.
Okay.
Okay, can you see my screen there?
Yes, we can see your screen. We also see the address bar, but we see your screen.
Okay. All right. So my name is Charles Carpenter, and I'm the Public Information Officer as well as the Chief of Legislative Affairs for the Industrial Commission of Arizona. The Industrial Commission of Arizona basically regulates workers' compensation claims, labor claims, and of course through the Arizona Division of Occupational Safety and Health, also known as ADOSH, we regulate the workplace safety. And so what I'm going to talk about is mostly the workplace safety initiatives that we're working on and going through. All right. So back in May of last year, Governor Hobbs signed Executive Order 2025-09. And with that executive order, basically ADOSH was charged with putting together a task force to develop some guidelines for employers, and also put together a recognition program. In July of last year, the task force met for the first time, and the task force is composed of members from industry leaders. We had safety experts, we had labor representatives, and we had, of course, we had safety and health and safety experts as well as health experts as well on that task force. And so the task force continued to meet throughout the next few months. And in December of last year, they put together their recommendations. And those recommendations are basically guidelines for employers. So the guidelines for employers included a written heat illness prevention plan, water, shade, rest, acclimatization, and training. And each one of those, they went into detail as far as what is expected for an employer to provide or to have at work so that they can prevent heat illness. And you know, the important thing about this document or about those recommendations that came out of the task force is that it was consensus. Everyone on the task force agreed to that document when it went out. And we had that diverse group, again, representing industry leaders, representing labor leaders, the safety experts. And to get that consensus, it took a lot of conversations and everything else. And furthermore, those people were reaching out to other stakeholders to make sure that we had a good plan in place or those good recommendations in place before we move forward. Those recommendations went before our ADOSH advisory committee. This committee is tasked with making sure that ADOSH is implementing guidelines that are basically for the benefit of workplaces. And so the advisory committee met first in February. It was a meeting to get public comment, and it later met in March to take action on those recommendations. And this committee, again, important to note that it was a unanimous vote to go through the committee. They did not need to make any changes to those recommendations, and they decided to send those recommendations on to the Industrial Commission. The Industrial Commission of Arizona met in April, so earlier this month, and on April 9th, through a unanimous vote, they adopted those recommendations. And those recommendations are meant to be added, or they're meant to work on our SEP, or our state emphasis plan, or state emphasis program, excuse me. And that state emphasis program is in place to basically provide guidance for employers, employees on heat in the workplace and how to prevent heat illness. So the state emphasis plan was originally implemented in 2023, following the executive order by Governor Hobbs in 2023. Basically, again, giving recommendations on what needs to happen in a workplace to help prevent heat illness. Those recommendations, the recommendations that came out of the task force and were approved by both the committee and the commission, are now part of that state emphasis plan, and are really guidelines for employers on what they need to provide in the workplace. It's also guidelines for our own ADOSH, our division, as they go out, what they're going to be looking for in the workplace to make sure that, again, our Arizona's workforce is protected from heat illness. I do want to mention we have a lot of resources for employers and employees, anyone who wants to look at it. And it's azica.gov/heat. And really that page focuses on heat illness prevention. What you're going to find there, you're going to find resources for employers. You're going to find where we've put signs and symptoms of heat illness. We have videos, we have pamphlets, we have all kinds of resources available. One of the biggest things that we do have right now, though, is we have a template. Every employer can go to this website, they can download that template, and they can use that to make their heat illness prevention plan. And that's critical. Every employer should have that if they have employees that are exposed to heat for more than 15 minutes in a day. It's just really important to have that. Again, a lot of resources for your employers, a lot of information for everyone, and just a great website for to help prevent heat illness in the workplace. The recognition program that was developed by ADOSH is the thermal program, and it stands for Thermal Hazard Exposure Risk Mitigation Achievement Leader. This program is going to recognize those high-performing employers. These are the employers that, rather than just stop at, okay, we've given everybody cool water, cool potable water, what they're going to do is they're going to add additional things like electrolytes, popsicles. They're going to provide, they have some construction sites actually have like those containers with cooling inside that allow their employees to go cool down. They can get some water, they can take a break. Cool suits, absolutely. We could recognize those as part of the thermal hazard, the thermal program. Basically, we're looking for those employers that have that high level of protections from heat. We know they are out there. We know what they're doing. We've even had an employer come to the commission, and they talked about how they have nurses on site. Those nurses provide IV hydration when appropriate, and they really do a lot in terms of making sure that their employees are hydrated and ready to work, and they do a lot to prevent heat illness in the workplace. And so they're going to be recognized through this program. I want to talk about some of the activities through the agency. Since 2023, we have greatly improved the data we're collecting. We're collecting claims data to look at the number of claims that are submitted for heat illness every year. We are tracking the number of heat-related inspections, and we know that we've done almost 240 heat-related inspections since 2023. We have issued citations. We're going to continue to track those numbers. And the one that I'm very happy about, and I apologize for the typo there, is that we have just under 1,000 consultation visits. A consultation visit is when you go to the site, they identify what is not working. They look at their programs, they look at their safety programs, and they help them to develop those safety programs that are going to ensure that those employees have a safe workplace. This is done at no cost to employers. And so we really want to get those employers educated and have those workplaces safe so that we can, protect Arizona's workforce. And what we have seen since 2023 is an overall reduction in heat-related claims. So we've seen the number of claims that are related to heat. We've seen them go down. We want to continue that trend. We want to continue to recognize those employers. And most of all, we want to make sure that Arizona's workforce is safe and protected from heat illness. And with that, are there any questions? Okay, I see no questions. Excellent.
All right.
Thank you, Travis.
Actually, can I ask a question?
Yes.
I'm wondering if you could give us a little bit of an update on that there was a proposal to make the advice and recommendations mandatory. Could you give us just a brief update on what happened with that, please?
Yeah, so we have there are some groups and coalitions that are asking for the commission to adopt a standard. And what happened is we focused on carrying out the executive order. We focused on those recommendations, and we went to that consensus of all of our stakeholders. Right now, what we're going to do is we're going to evaluate the improvements to the state emphasis program or state emphasis plan, and we're going to move forward in that direction. So that's the direction that the commission is going to go. When we look at adopting a standard or a rule, that's rulemaking. And when we go through that process, we need to make sure that we're engaging our stakeholders and doing all those other things.
Thank you.
And the thermal measures, when will they be released for review? What it is we had to get everything through the commission first. In other words, we had to get those recommendations approved. Now that we have those, we have our basic platform for the thermal program. We have that already made and done. What we will be doing from that point is we're going to start taking those employers that want to apply for that recognition. I think we're actually doing it now, and they can reach out to our ADOSH consultation services or ADOSH consultation for that.
Okay, thank you so much. Next up, we're going to hear from Mona Aurora with the University of Arizona and Darian Fuller with the Arizona Department of Health Services.
Thanks, Jenny. Can I share my screen? Do I have permission to do that?
Yes.
Perfect. Thank you. 1 second, everyone, while I pull up the slides. All right. Let's see. 1 second. Do you see my slides or do you see my cheat sheet?
We see your notes page.
All right. Let me, can I have 1 second, Jenny, just to do this? Sorry.
No worries.
let's see if I can share. Do you see my slides this time?
Yep, perfect.
Perfect. Thank you, Jenny. Thank you, everyone. Glad to be here. My name is Mona Aurora. I am with the University of Arizona, wearing two different hats today, with the Southwest Center on Resilience for Climate and Health, and also with the Center for Rural Health. My co-presenter will be Darian Fuller. Darian, would you like to introduce yourself?
Yes, hi, good morning, everyone. My name is Darian Fuller. I am the tribal health epidemiologist at ADHS, and I'm very happy to be here and present with Mona once again.
Absolutely. Likewise. Thanks, Darian. So I know we've been learning a lot of different, information and resources, and many of them have been concentrated kind of in our urban landscape. So for the next 10 minutes or so, we're gonna actually kind of have everyone think a little bit broader across our geography here in Arizona and really kind of think about, our rural communities, rural and tribal communities. So the heat dashboard that Dr. LeVar had mentioned, if you look at that, some of that data, there's different ways you can actually visualize what's happening. And so this is just a snippet of, we wanted to just kind of get everyone thinking about kind of the rural heat space. So if we look at ED visits for 2025 and we just look at counts, clearly we know where some of the hot spots are within the state. Now, if we change how we look at the data and we look at the rates per 10,000 emergency department visits, it kind of changes our perspective, right? And that's kind of one of the things that Darian, myself, Jenny, and others have been working on is really just to kind of understand and to build some of the networks and the capacity in our rural and tribal communities when it comes to heat preparedness and response. Darian, I'm going to turn it over to you to talk a little bit about kind of the tribal data and kind of take it from there for the next couple slides.
Sounds good. So we wanted to have a conversation with various groups of people, including our tribal partners and those of us that live in more rural areas, because the way that heat affects those areas is going to be different across the state, as you can see in the chart right there. So even if it's not in an urban setting necessarily, there is still a lot of impact from heat in those more rural areas. Next slide, please. So as I mentioned, heat is not one story, and so these locations can have different reactions to the heat. So in rural communities, we see extreme heat temperatures vary from shorter episodic summer heat to chronic year-round heat. And a lot of homes are not built for those sustained long periods of heat. And there's a lot of transportation barriers to cooling centers and other heat relief measures. And the risk is amplified by geography, the distance to basically everything. But at the same time, there are a lot of data gaps and there's a lot of sparse representation in the statewide heat convening. So we hear a lot about the urban communities, the rural voices, the tribal voices, they're not as present. In the urban communities, we see the longer duration of the heat. We get like the urban heat island effect, and we build with a lot of concrete and surfaces that retain heat. And we have a lot of warm nights here in the more urban space with reduced nocturnal cooling. But heat relief infrastructure is more unevenly accessible. So in some places it might be more accessible to people, but there are still locations within the urban setting that it's still difficult to get to. But like I said, we have a lot of information about our urban setting. So we have more robust heat surveillance and health data. And of course, heat risk depends on a ton of different factors, including the individual health, any medications you might be on, duration of high temperatures, access to shade, effective cooling, and heat relief. Next slide.
Thanks, Darian. So kind of with that in mind and the focus, I think, really being across ADHS across some of the work that we're doing here at the U has really been to start expanding kind of our heat preparedness and response kind of platform and our approach. And so last year we did 6 rural heat focused listening sessions. You see kind of the numbers of organizations and people we engage with. And over the next couple of slides, what we're going to do is really just kind of highlight some of the things that are already happening in place in the hopes that the network of individuals here today or those accessing the recording later are aware of some of the things, the synergies that are already existing, but then also maybe some steps that can be tailored or adapted to rural and tribal communities. So, no surprise, there are a lot of similarities. Darian touched on some of them when we think about urban and rural tribal landscapes and communities. One of those is the heavy reliance on local partnerships. And if we look at it from kind of a strength-based kind of approach, a lot of what we kind of heard in our listening sessions and our conversation was a lot of reliance on traditional kind of healthcare partners, but also non-traditional partners like libraries, casinos, cultural centers, to really grapple with the heat risk that was occurring in communities. Many of our participants that we spoke with talked about not just heat as the driver of action, but also heat in combination with the power outages, even with monsoon disruptions, really were kind of the triggers for activation of incident command, for example, or to mobilize resources. And some of those resources are very tailored to the communities, as you can see on your screen. A lot of reliance on community health representatives, the promotora infrastructure, the mobile meals programs that exist in the communities to get information out, but then also to really do kind of like a reverse 911, but door-to-door kind of checkups among vulnerable community members. Really kind of the bottom line, and when we look at what's already happening is, rural communities know who's at risk, know where to go. And those personal connections often are kind of the lifeline when the systems are not in place or are really overstretched or stretched thin in terms of providing any existing kind of relief. So a lot of heavy reliance on those partnerships, whether it's distributing water, providing transportation, so going out to somebody's home and bringing them to a cooling space, if it's within kind of a travel distance, not like a 6-hour travel distance, and then also a mixed approach to communication. So flyers in food delivery packets, phone calls, radios and newspapers, not so much as kind of social media. Really a lot of variation, but both traditional and non-traditional ways of communication. And then just really working on those creative workarounds to kind of get the word out and really provide services to communities that need them. Darian, do you want to talk a little bit about some of the recommendations coming out?
Yes. So when we held some of the listening sessions, I was able to attend one at the Heat Summit this past, almost said semester, not semester, fall. And some of the recommendations that came out of those listening sessions were to prioritize rural and tribal areas with flexible long-term funding. So reduce some of the restrictions and expand systems that are already in place. Also to co-develop localized data management systems and give the communities a voice in how data is presented. Also to improve death certificate coding and just kind of level up the data that we have. And also to formalize tribal data sovereignty and develop intergovernmental data sharing agreements with tribal nations and ensure that those tribal nations receive the data in culturally appropriate ways, which I'm glad to say that our Indigenous health sovereignty or Indigenous data sovereignty policy is rolling out very soon. Next slide, please. Another recommendation is to establish clear, actionable heat guidance, and make everything very direct and easy to intake at, a fast level of just these are clear and understandable heat alerts and, nothing too extra. But also use multi-channel culturally appropriate outreach. So like Mona mentioned, using radio, flyers, phone trees, door-to-door stops, to reach those people in the rural areas that don't have internet or smartphones or don't use them. A lot of our tribal elders don't have a smartphone and don't really interact with anything on social media. Um, and lastly, coordinate and empower communities through rural and tribal heat policies. So integrating the element of heat into core public health programs, and have regular preseason planning meetings such as this, and update infrastructure standards and building codes.
Thanks, Darian. So just as a takeaway as we wrap up kind of our portion of the presentation, really I think the bottom line is, just recognizing the diversity and how heat is, felt, is experienced across our state, and just being mindful of what kind of strategies might already be in place and leveraging those. If we look at our state, and I think Tom's slides kind of spoke of this pretty well, which is, we have urban heat, right? But then if we look at like western part of Arizona, western part of our state, sometimes we have 90s into what we call our fall and winter, right? So there's more chronic heat. And maybe in northern part of our state, there's pockets where it gets warm, but it's, warm is relative, right? So it's 90 or 100, which is above normal for them versus what we're used to here in the valley or down in Tucson could be higher temperature. So really kind of working with the local partners. The recommendations here are not just for local health departments, it's for anyone in that space, working with our communities, just knowing who to go to, being aware of the Civic Roundtable and the resources that the ADHS team and others provide. And then just really being able to be mindful of, using more culturally appropriate, geographically appropriate modalities to get information across and to just amplify heat prevention resources well in advance. And with that, just want to say thank you to everyone who did participate in our listening sessions and who's working in this space. Here's Darian and my contact information. We're happy to answer questions or work on this more with you if there's interest. Thank you.
All right, thank you, Mona and Darian. And just, I'm noticing time. So if we could direct questions to the chat, and then Mona and Darian, if you could just monitor that in case questions come in. All right, perfect. Next up, we have, let me see, Grant Harrison with the Phoenix Sky Harbor International Airport. Is Grant online?
I am. Good morning,
Awesome.
everyone. Let me
Morning.
get my presentation up. And hopefully everyone can see that online. Perfect. Good morning, everyone. I'm Grant Harrison. I'm the Heat Ordinance Coordinator for the City of Phoenix Aviation Department. My role is to ensure contractors working on city projects follow our heat ordinance so workers and crews are protected during our extreme summer heat. And here's a quick video about how my position got created here at the city.
Secret, working outside in the heat here in the valley is dangerous.
Last Wednesday, June 15th, a week and a half ago, it was 112 degrees at 3:11 p.m. I took my heat gun out. The tarmac was 155.
People who work for contractors at Sky Harbor shared their frustration today with city leaders.
The existing ordinance, even without any changes today, requires that contractors provide access to air conditioning in vehicles with enclosed cabs.
That requirement went into effect in May.
We have about 22 trucks, and out of those 22 trucks, there is only 4 trucks that has working AC units.
This man testified that many of the AC units blow hot air and lose charge after about 2 hours. And he says there's a rule against workers bringing their own water on the trucks.
Now they have safety drivers inside the airport providing water, like driving and providing water. We have to wait until we get one brought to us.
I cannot think of a good reason to not let people have bottled water.
Mayor, members of council, I was a bit surprised by that testimony as well.
Aviation Director Chad Makovsky said they'll be looking into that water bottle policy and the AC issue in the trucks.
I'm going to direct our staff to have our contract guards at those gates actually check the vehicle as a part of their inspection to see if they can feel cool air coming out of the air conditioning units.
The concern wasn't only compliance, but also retaliation.
I'm so afraid of what is going to happen after I come here and talk, because there are retaliations, and I'm so afraid of that. I got family. I got so many bills to pay.
One worker said she lost her job last year after protesting about working conditions.
Soon after, though, I was fired. The reasons for my firing are suspicious at best.
Makovsky encouraged workers who are afraid to bring concerns to management to report them via the Say Airport app.
Yes, passes 9-0.
In a statement to Arizona's Family, Deputy Aviation Director Heather Shellbrack said, quote, "The well-being of employees at Phoenix Sky Harbor International Airport is of the utmost importance to the city of Phoenix, especially during the summer months of extreme heat. We appreciate the council's action to enhance the ordinance to make it easier for contract employees to report issues. Any additional language to further enhance the ordinance will be done in the coming months." And as mentioned, there were several amendments made to the current ordinance today. We will have a full breakdown of that on azfamily.com. Reporting from Sky Harbor, Karina Rubio for Arizona's Family.
I feel like everybody at home watching is wondering why we need an ordinance to allow these workers to bring their own bottled water if they're working outside.
Perfect. So part of that amendments came along with my position was created. So I'm in charge of making sure our contractors are compliant with our heat ordinance. So what is our ordinance? The heat safety ordinance outlines the minimum heat illness prevention requirements for contractors performing outdoor work under city contracts. I review their heat safety mitigation plans and conduct site visits to confirm those requirements are in place and functioning effectively. If anyone is curious about what the full ordinance entails, you can scan this QR code here, or feel free to reach out to me and I can email you a copy of that as well. So contractors' requirements are: first, they must maintain a written heat safety and mitigation plan. 2, post that plan in English and Spanish in their break room. 3, provide a clear contact number for questions or concerns relating to heat in their workplace. And 4, in their heat plan, it must include anti-retaliation language to protect workers who speak up. So the heat safety mitigation plan is where the contractors explain how they're going to meet these requirements. A good plan answers where water is located, how often it's refilled, how breaks are scheduled, and what does that look like on a busy workday, where shaded or cooled areas are set up, how do supervisors spot signs of early heat illness, and what's the protocol if someone does come down with a heat illness or heat-related illness. When reviewing these plans, I'm looking for content that makes sense to the specific type of work, not just a generic template. And there are 6 main components of the heat plan that the city requires. The first being water. Water is the most basic protection workers have, and it's also the one that fails the quickest if contractors aren't paying attention. The ordinance requires cool, clean, sanitized drinking water available for free that's easy for workers to access. The second requirement are breaks. Workers must have the opportunity for regular hydration and cool down breaks. The third requirement is workers need access to meaningful shade or cooled areas. This can be simple, like canopy tent or access to an air-conditioned space, but it must offer real relief. The fourth requirement and one of the amendments are all enclosed vehicles must have functioning air conditioning per the manufacturer specifications. And this was one of the amendments that was mentioned. Along with that, they recently updated it to where contractors now have to keep monthly vehicle logs to ensure that their vehicles are actually maintained, and they send me those vehicle logs as well. The fifth requirement is acclimatization practices. New workers returning after time away need time to adjust. The contractor's plan should show how they ease workers into shorter shifts, more breaks, or lighter duties for the first few days. OSHA recommends this schedule for workers that are new to extreme heat, and this schedule for workers that are returning from a prolonged vacation. And the sixth and final requirement for the plan is contractors must provide training to ensure workers recognize heat symptoms and how to respond. And when I'm on site and before the summer starts, I like to give contractors this checklist here. And that just shows that they have the heat plan posted, that water is made available to all workers, breaks are occurring, shade or cooling spaces are ready, vehicles have AC logs and vehicles have functioning AC, and that they've completed their training before the summer begins. And here's my contact information. Feel free to reach out to me if you all have any questions about anything that the city is doing regarding to heat ordinance. I do cover the Phoenix Sky Harbor Airport, our Deer Valley Airport, and our Goodyear Airport. And with that, I thank you all for letting me share about my new role here at the city.
All right, thank you so much. There is a question for you in the chat if you want to take a minute to respond in the chat.
Yeah, let me scroll down and look at it. Where can the training be attained? So right now, the city, for our city workers, we have our training online. We require each contractor to provide their own training. A lot of them look for OSHA standard heat illness training, and that's where I direct them for that. But most of our contractors here at the city, I've been noticing they have their own internal system of how they train, and I've been looking at those to see, and they cover all the heat illness issues.
Very, very good. Thank you so much. All right. If there's any other questions, please send those to us in chat. All right. Next up, we have Vicky Cusino from Direct AZ.
Hi everybody. Taylor, I can't share yet. Okay. Now I'll share. Hi everyone, I'm Vicky Casino from Direct Advocacy and Resource Center. We're one of the 5 centers for independent living in Arizona and serve people with all types of disabilities. And I also serve on the Arizona statewide Independent Living Council. And that's relevant in a minute. So I want to talk to you about ensuring accessibility at heat relief sites or really anywhere. So this is a statistic that comes from the census. The CDC put this together. It says disability impacts all of us, and that more than 1 in 4 adults in the United States have some type of disability. And I want to emphasize that it's adults, so this does not include anybody under the age of 18. And it also doesn't include anybody in institutional type living. So that means it excludes anybody in a jail or prison, as well as nursing facilities. So we would suggest that number is probably even much higher. Okay. The reason we're talking about disability related with heat, just a quick overview, is that with some disabilities, heat can pose some severe health risks, increase hospitalizations, or even lead to death. And this is because heat can impede the body's ability to regulate temperature. For example, people with spinal cord injuries, cerebral palsy, certain mental health disabilities, respiratory and cardiovascular diseases, and those are just some examples. Another reason is that certain medications can increase heat sensitivity or hinder the body's ability to cool down. And an example is certain antidepressants. And then lastly, individuals with disabilities experience disproportionately higher rates of social risk factors, including very low income. And so with that, for example, individuals with disabilities may have limited access to air conditioning. So, accessibility tools in action. We wanted to brag about this a little bit. The Arizona Department of Health Services Community Advisory Board on Accessibility and Inclusion, and Taylor's team at ADHS, and the Arizona Statewide Independent Living Council collaborated to develop this fact sheet, which I will put in the chat as soon as I'm done. It's a simple one-pager about how to make heat relief sites accessible to people with diverse disabilities. And it aligns with various disability and civil rights laws at both the state and federal level, whilst also recognizing that we do have our sovereign nations in Arizona. So we tried to make the guidelines sort of highlight proven practices for accessibility, but noting that they do align with the laws as well. So one thing we've learned is that when we talk about accessibility, oftentimes people immediately think about physical accessibility. When you hear ADA, Americans with Disabilities Act, our minds often go to that physical accessibility, like ramps or zero-step entrance instead of steps. But there are actually three main paths to accessibility that are covered in those disability laws, such as the ADA, the Arizonans with Disabilities Act, the Rehabilitation Act, Section 504, and other state and federal laws. So there's more than physical accessibility. So when we talk about compliance with the ADA or those laws, it goes beyond the physical facility. So we'll talk a little bit about that. And then at the end, we'll sort of talk in general about how to ensure broader accessibility. So those three paths to accessibility are the physical accessibility, the facilities, so removing architectural and physical barriers. The second is reasonable modifications of policies, procedures, and practices, and we'll talk a little more about that. And then effective communication, and this is a big one. And it may mean providing auxiliary aids and services. So now we'll talk about each one of those. And if you have questions, please put them in the chat. Please use your emojis if you agree or disagree or learn something new. It's kind of nice to see that people are interacting. So regarding physical access, and this is on the fact sheet, but I do want to note this is a one-page fact sheet. So it just highlights a few of the proven practices, and there's a lot more to it. So we highly recommend for physical accessibility that you use an ADA checklist and really assess the site. And there's a link on the fact sheet as well as this presentation for this ADA checklist. Um, and I want to note that the checklist is like 90 pages. So to give you an idea of how extensive it is. And it is based on the ADA standards for accessible design. And those design standards, the booklet, I want to say it's close to 300 pages, about 290. And I say that not to overwhelm you, but to give you an idea of how extensive the Americans with Disabilities Act is. And to note that we think this fact sheet is awesome and really gives you a good start in making heat relief sites or any site more accessible. But it's just a starting point. Oh, and sorry, I'll back up. I gave a link to this checklist, but if there are checklists designed specifically for like health or medical sites, emergency shelters, recreational areas. So if anybody's interested in those specific checklists, you can Google them or reach out to me and I'll get them for you. So regarding physical access for heat relief sites, we noted a few priorities. Accessible parking for cars and vans with lifts. And we emphasize that just because it's not about just having the parking spaces, say, closer to the building. It's also having those parking spaces with the access aisle where somebody who has an accessible van can lower their ramp or lift and exit in a wheelchair and still turn and not run into the other car. So it's important to have fully accessible parking. Clear signage, and that's inside and outside. And for example, signage to accessible entrances and exits and restrooms. Accessible restrooms. There's a lot of guidelines for this, and I just provided two examples. Roll under sinks, so somebody in a wheelchair can easily access the sink, grab bars, but there also should be at least one accessible stall with turning radius for a wheelchair. Extra chairs and wheelchairs. And this is because maybe somebody doesn't come with their own wheelchair, but they have limited mobility. And if there's ever a line or something, they may not be able to stand for very long. So it's really helpful to have, oops, sorry about that, chairs and wheelchairs available. Private room or quiet space for individuals with neurodivergence or any type of sensory disability. For example, individuals with who are on the autism spectrum or have certain mental health disabilities really might need that quiet, sensory-free area. Sensory items to help reduce anxiety, and the biggest example is like stress balls, or little fidget toys, disposable earplugs, if it's a noisy area. And then this is not a requirement in the laws, but we highly recommend it to ensure accessibility for the heat relief sites is having water bowls for service animals. And of course, to ensure that your sites are friendly to service animals. Service animals are really critical to individuals with disabilities who use them. And we don't have time to go into it, but service animals do specific tasks for individuals with disabilities, and they're different from therapy or support animals. Therapy and support animals are not covered under the law, only service animals. Service animals do all kinds of tasks like pick things up for somebody in a wheelchair or go and turn lights on and off, check around corners for somebody coming, for an individual with PTSD. They may be guide dogs for somebody who's blind. Even though the therapy or support animals are not covered under the law, we would encourage you to make sites friendly for them unless the animal causes an issue. And then if they do, then of course you could remove them. But service animals should always be included. That is covered under the law and helps individuals who use them continue to live independently and do tasks on their own. Reasonable modifications of policies, procedures, and practices. This is really important because, there are all types of disabilities and they impact people in different ways. You can have two people with the same disability who have very different functional needs. So it's hard to plan for everything. So under the law and as a proven practice, ensuring accessibility really requires willingness to problem solve with individuals with disabilities and being flexible and finding solutions. We encourage you to regularly review and update existing policies and procedures and create new ones as necessary. As situations come up where you need to modify policies, practices, and procedures, it should be a good time to think, oh, could this come up again? Maybe we need to modify our current policy, practice, or procedure, or maybe we need a new one. And some examples of modifying policies, practices, and procedures is providing orientation and wayfinding assistance, say, to somebody who is blind or with low vision, or helping them fill out paperwork, providing those low stimulation or stress relief zones. Okay, effective communication. I have to say, this is really, really critical and sometimes gets lost, and it's so important. What the laws require is that communication with people with disabilities must be as effective as with non-disabled individuals. So, if somebody is deaf and their primary language is American Sign Language, ASL, and you try to communicate with them by writing notes, that likely is not going to be effective communication. They may not even be fluent in English if their primary language is ASL. That said, in an emergency or for a very quick communication to establish, what type of aid or service is needed, doing those short notes could be a way to communicate, but it has to be a very short communication. It's not going to be effective for any lengthy communication. Examples of aids and services that may need to be provided are qualified interpreters, which in Arizona requires licensing by the Arizona Commission on the Deaf and the Hard of Hearing. Providing alternative formats like audio or braille. CART, which we have today, we also have the sign language interpreters. CART is communication access real-time translation. It means the real-time captioning. Having a hearing loop or audio induction loop, and there's so many more. And that's why it's important to problem solve or talk to the individual to figure out what will facilitate the most effective communication. So priorities regarding communication for heat relief sites is having distinct policies, procedures, and practices for arranging interpreters, ASL, and other interpreters, as well as other types of auxiliary aids and services. And along with that policy, there should be a point person for doing that. Developing fact sheets or any of your materials in plain language and providing simple diagrams and pictures when possible. Diagrams and pictures are very helpful for individuals with intellectual and developmental disabilities, as well as some mental health disabilities. And just helps with processing in general, providing things in both words and picture as much as possible. When you develop your materials, having electronic text, a basic version in electronic text. And the reason I say this is with technology these days, a lot of people rely on electronic text, whereas we used to produce a lot of alternative formats like Braille. I work at a center that serves individuals with all types of disabilities, and we have a couple of services specifically for people who are blind. We very rarely produce Braille because most of the time, individuals want the electronic text, and as long as it's basic e-text, they can read it with their devices. And so we offer that as a proven practice because if you have that electronic text, most times that will help most people. But when somebody needs an alternative format, then you should have a process for being able to provide that promptly without a lot of turnaround time. Another is communication cards for individuals with intellectual and developmental disabilities or those who are deaf and hard of hearing. And I have a screenshot of part of one over here on the right. And they're cards with little pictures and just short sayings or words. If anybody's interested, I have some specifically for emergencies in English, Spanish, and sign language. And they provide, letters so people can spell words or just point to a picture. So they can be really helpful for some of that short-term communication. Clear masks or face shields. So if masks or face shields are required, it's best to have clear ones so that individuals who rely on lip reading can read your lips so you can facilitate communication with those individuals. And then more time to communicate. And this means more time if you need to explain a service or procedure, but also more time for, say, an individual with an intellectual disability to kind of process the information and understand it. And you might need to repeat things. And this is a big one. This is something that I think everybody can do fairly easily, is taking your time and allowing enough time to communicate with people. Lastly, I wanted to talk about like full accessibility versus ADA compliance or compliance with other laws. And this is just sort of our vision. I want to put it into perspective with you. We get calls all the time about doing training on ADA accessibility, and I'm a certified ADA coordinator, so I do that type of training all the time. And I can certainly do training on how to comply with the laws. But what I want to emphasize is that those laws, such as the ADA, focus mainly on removing barriers. Unless you're building like a new facility and you follow the standards. But even the ADA standards for accessible design, they're kind of the bare minimum of accessibility, right? And they're not going to meet everybody's needs. So, with that, when you focus on just complying with the law, there's going to be ongoing remediation. So, you'll likely have to, just do it often, or as situations come up. We kind of call it the firefighter method, because you always have to focus on removing barriers. My center, our vision is of universal accessibility, and there is some of you probably are familiar with this. I recognize some names of those who are participating. Universal design. There are 7 standards for universal design and principles, but the concept, very briefly, is that whether it's a building, a program, a service, or a class, whatever you're doing, that it is readily usable by everyone without remediation. So the idea is, before creating it, think about all the people, not just disability, but disability, age, ethnic background, race, all those things. Think about all the people who will use it or need to use it, and design for everybody. And so that people can easily enter and use things or access things without asking for something different, without asking for barrier removal. And yes, that is hard to achieve, complete universal access. But I want to talk about that just because if you just get caught up on compliance and the law, it's kind of narrow. And if you start to sort of think about, okay, approaching it from who needs to use it and what would make it easily accessible for everyone, and designing that way. I hope that makes sense. And my contact, you'll get this presentation. This is my contact information. I'll put it in the chat, and then I will also put the fact sheet in the chat as well. And I know, I believe Taylor's going to send it out as well. Thank you, everybody.
All right. Thank you so much, Vicki. And there is a comment in the chat if you want to take a look at that in a minute. In the meantime, we will introduce our next speaker, Patricia Solis, with the Knowledge Exchange for Resilience at the Arizona State University.
Hi, good morning, everybody. I know we're very short on time, so I'm going to say the most important thing that I have to say first, which is thank you. Thank you to everyone here for everything that you do to make sure that the people of our state are taken care of. And thank you for inviting me, for sharing what I know some of you have been working with me on for the last several years here. And I hope you can see the right view.
Yes, we can see your slides.
Okay. And I appreciate you, Taylor, and also Dr. Levar, for letting me talk about something that is I've been working on for many years, and some of those research have been working on with many of you here in the room today. So I encourage you to put yourself in the chat and let me shout out to you. We're going to talk about extreme heat resilience strategies for people who live in mobile manufactured homes. And I'm going to actually fly through this a little bit to save a little bit of time. So forgive me if I gloss over some of this. If we think about what the needle is that we're trying to move here, if we think about it in its entirety, like 100% of the heat-associated deaths, and this is for the statistics from Maricopa County, where I spend most of my time working. Obviously, we are concerned a lot with the outdoor place of injury, but if we're looking at those who perish indoors, it's disproportionately people who live in what we call manufactured homes, mobile homes, RVs, and trailers. That's how it's reported in the statistics. And it might look like this little smaller sliver. However, only about 5% of the housing, depending on what location, what county you might be in Maricopa County, that's disproportionate. 30% of the heat-associated deaths year to year, year over that time frame are in this type of housing, but that's not representative of the type of housing that we have in our county. And in fact, 23% of indoor heat deaths are adults aged 65 or over living in this type of housing. They have a hard time keeping these homes cool. They're 3 times as likely not to be able to have the electricity turned on due to some of the costs. They have a difficult time being able to pay in many of these types of homes, not ubiquitously. There are many of the parks and types of homes that are affordable, and this is not describing all of the types of manufactured homes, but there are many that there is a lower income residence types of affordable housing. So in doing some of these statistics, I was trying to divide it into the types of responses that we have pre the utility moratorium and post moratorium. And there is a little bit of a shift that we can see in the use of electricity before and after, but you don't see in the share of proportion of deaths in this type of housing among indoor heat-associated deaths. And we're really just shifting that burden from turning on and using that electricity to weatherization problems and the other types of issues with the being able to non-functioning air conditioning. So it is a systems problem. It's a resilience problem. So we like to look at it at ASU in a very holistic kind of way and get our handle on what is the universe of problems and what are the universe of types of solutions. So we look at the types of vulnerabilities of people who live in the types of homes, older populations, people with less capability of finding solutions, maybe with the families who live in there, the work that they might be doing, ability to communicate the types of solutions, and then the exposure, the actual buildings themselves. Many times in the urban areas, less shade being in the lots themselves. And then in the terms of rural areas, they might be on land that is less access to because some of the resources. Transportation is also an issue, as we've heard earlier. And what we call adaptive capacity, there are tenancy issues. They might own the home and then rent the lot. So they might have different types of ability to control the solutions that are available to them and the power relations that they're working with. So one of the things that we wanted to do first at ASU is try to get a handle on this. I enlisted my students and a program that I normally use in international humanitarian contests and tools that we have to do sort of an assessment statewide, and it's a tool called MapSwipe where we put communities on the map, and we didn't really know exactly how many communities that we were talking about, and using AI and building footprint data and tax rolls, we found that it was an underestimation by about 7 to 10%. There are, by our estimates, about 175,000 homes conservatively across the state who are in the category of needing weatherization and or LIHEAP dollars. And we're not quite serving that many with the programs that we have. So we also took it upon ourselves to do some intensive studies of about 70 different homes across the valley where we work, interviews, these little buttons to tape inside and outside the homes, a lot of assessments, deep dives of what were the kinds of thermal exposures and insecurities, as well as solutions that people were looking at. And you can see the maximum indoor temperature that we recorded for any participant was 111. That was indoors. And we kind of compared that to what was some average temperatures of other types of housing. So we could just actually see what that compares to, and to other types of structures. And we published this in some studies, just so we could get an assessment of what those exposures and vulnerabilities were. Even flew a drone. Don't laugh. My drone fell out of the sky because it was too hot. But we did see, you don't want to really see these blue squares. That's someone actually cooling their roofs. We don't want to see that. That's actually quite unusual. So we got a pretty good assessment. See that right there. Of where people were literally falling between the cracks of the programs that we were offering. So if you'd like to see any of these studies, I have a library of those things. We also wanted to document what were the experiences of our residents. We have a series of documentaries, how resilient they are, working with AMHO and residents themselves, the affordability. This is a really nice recent documentary put out by our colleagues in University of Arizona in Tucson, being affordable housing. And then my students recently looking at the accountability issue. We heard the airport folks talking about accountability as part of that system, making sure that people are checked on. All of this was documented in what we have. Here's a QR code to that, a solutions guide. People do have solutions. They're technical, green solutions, but also policy solutions and social programming. Some of them can be implemented themselves. Some of them have to be implemented at different levels. I'm just going to throw them out there so you can see what they look like and the range of them. Everything from what an individual household can do, skirting, some of these things that you can see, using LED lights in the home. We worked with our students, created their own LLC for a Barrett Honors project to do an early warning system that is very low cost to alert their loved ones on when the air conditioning gets turned off. To the park level, where there's shade sails, and we worked with 3M on a film that could be placed to actually reject heat. Cooling centers within the parks. We worked with the utility companies. There actually is a master metered, some even within one park, you might have master metered versus individual metered. And the utilities didn't even know which customers were which. And we reverse shared some of our data with them. We developed an integrated resource plan so that landlords actually need to have their own plans for when they have power outages, because the utility companies don't do that. So this is available to any landlord, to any park resident, for how to create their own plans. At the city levels, even many of the cities took some of these recommendations. The fire departments, you have to often get permissions to go into some of the parks to implement some of these things. And so working with AMHO and some of the residents themselves. One great example is the city of Tempe created their own home retrofit program. The results are really wonderful. You can not only reduce electricity usage and electricity costs, but also emissions, and that has some additional health benefits. So that is a fantastic example of how those things can work. We work with the state on some of their own programs, like renewing suggestions for tax credits and public safety standards. These things actually went to working with AMHO. I testified for a new state law, because just even removing some barriers, sometimes you wouldn't think like a city ordinance, you wouldn't think that you would need sometimes some regulatory environment to convince people that this is necessary, but just allowing people to cool themselves. Those things are really important. We try to elevate these things to the national level. I work with the U.S. Census Bureau to make sure that this is reflected as well in our national standards, our national data standards. There is a national-wide data that includes resilience estimates for heat and experimental data product that does include housing type, include that this is reflected back to us that we have adopted in the state of Arizona for a social vulnerability index, so that this type of housing is understood as vulnerability. And then, of course, understanding all of this, when I worked with the Governor's Office of Resiliency, we took these lessons into the extreme heat preparedness report of recommendations and the plan. One of the challenges is our workforce. We wanted to make sure that that was reflected into it. Even if we did have all the funding in the world, we don't have enough of a workforce to help make these things happen. From a result of that, actually, Eugene and I are somewhere in this in this picture here, making those things known as well at the federal level and in the federal recommendations. So I just wanted to make sure you're aware of all of these things. There's a lot more detail in that. I want to make sure that you have a copy of this presentation. All of these folks that have been part of this work, they're fantastic to work with, especially AMHO. I want to give a shout out to those folks. They are still working very hard on the solutions that affect the residents every day. Thank you.
All right, thank you so much, Patricia. Again, I'm going to direct questions to the chat. We do have 2 more speakers. We are recording, so if people had to drop off or will have to drop off, please come back and watch the recording. I will introduce our next speakers, Sean Scott and Jennifer Barahona.
Hello, I don't know if Sean is still here.
Okay. Is Jennifer here?
Hi, can you hear me?
Yes, we can hear you.
Awesome. So I don't know what Sean was going to talk about, probably our weatherization program, which if you live in Maricopa County, aside from Phoenix and Mesa, you can apply to. And right now we are, there we go. We are prioritizing AC units. So if you apply and you're in need of an AC unit, you'll move up our wait list, though our wait list is very, very long. I primarily work for our, oh, there she is.
Can you see me in here? That was rough. I got kicked out right when you called my name. So can everyone hear me? I see the lady signing, so that's good. Okay, I will be quick. Hi everyone, I'm Sean Smiley Scott. I am the program director at All Thrive 365. I've been with All Thrive for over 17 years, mostly working in weatherization. And on with me is Jennifer Barahona. She's our program coordinator for our emergency AC program. She's been running that program for 2 years. For those of you who don't know who All Thrive 365 is, we were formerly known as the Foundation for Senior Living, or FSL Home Improvements. And we've been helping Arizonans thrive for over 50 years through health, housing, connection programs. So we provide support and resources needed to embrace life at every stage, 365 days of the year. I had to add that in. And today I'm going to be focusing on the support we provide for heat relief. We have some wonderful programs that support our folks in the community to manage the heat we face every year in Arizona. The first one I want to talk about is our Weatherization Assistance Program, which is funded through the Arizona Department of Housing. Shout out to Travis in the chat if he's still there. This is not an emergency program, but we do prioritize clients with no pool, children, elderly in the home. We do have an extensive wait list that we're working through. So we're constantly, completing weatherization projects. To become eligible, the homeowner would have to fill out an application. They must live in Maricopa County, meet income qualifications, and own the home. Although renters can benefit from this program as well upon review. It's a case by case with renters depending on the situation, and they have to obtain a tenant landlord agreement to do the work. And then our energy auditors will perform an audit, and dependent on the needs of the home, the client could receive an AC, new appliances, sunscreens, installation. You can see on the weatherization flyer the specifics on how to apply. We have an online inquiry form as well as the contact information request to request an application via email or phone. And our intake coordinator, her name is Zelia Trimble, and she's top tier. She's been doing this a long time, so she's great with our applicants. And then if you can go to the next slide or next flyer that I have, please. Okay, so the next program I'd like to speak about is our Healthy Homes Air Conditioning Program. In 2021, the Healthy Home Air Conditioning Pilot Program was created to eliminate heat-related hazards for vulnerable low-income households. This program specifically allows us to address emergency heat relief for folks that have no cooling in the home. So this is a repair, replace for HVAC only. We aim to have the contractor out at the home within 2 to 5 days upon application approval. So we try to get out there fairly quickly. The funding is limited, so we try to utilize this program when no other options exist. So if they're not eligible for weatherization or have already had a weatherization. And then the eligibility requirements are they must live within La Paz, Maricopa, Pinal County, Yavapai, or Yuma County. Priority will be given to older adults, people with disabilities, and people with small children. And my light goes off. I'm just glitching over here. And they must meet the income qualification listed on the flyer. And Jennifer Barahona, she's our intake coordinator for this program. And I also want to mention lastly that we do utilize portable ACs for both programs while clients are waiting to get their AC repaired or replaced. That can come with some caveats, but it's just the stress that we go above and beyond to meet needs of people. We take heat very seriously. And we've been doing this a long time. Some of the folks on our staff have been doing weatherization for over 30 years. So I feel like that's given us the success that we've had running these programs. And that is all I have. So if you guys have questions, I would love to answer.
Thank you so much. We have one last speaker and then some closing remarks. So I know, Emma, you just needed a few minutes. Are you still able to share with the group?
If Emma is not, I am still on.
Okay. All right, Emily.
Hi, everyone. So my name is Emily Benz. I am part of the team at Civic Roundtable. And as many of you have probably heard, it's been mentioned a few times throughout this presentation today. We have the Extreme Heat Preparedness Network on Civic Roundtable, which is a tool for you all to continue the conversations and connections today. I'm going to just spend a couple of quick minutes going through what this looks like today so that you guys can get a sense of how to use it and what to expect. Important, all of you have the ability to share information on this feed here, whether it's information around new funding assistance, utility assistance, opportunities to make ways in your community, updates from counties. All of you have the ability to post, share information here, like and comment, and contribute. Also importantly, this is your directory of over 380 people that are part of Roundtable and part of the Arizona Heat Preparedness Network. We know that means folks that are specific in health departments at the state, local, county, city, and nonprofits, faith-based organizations, other community organizations that are involved to help bring together everyone involved in heat. You can use the filters at the top here to find people. For example, maybe you're looking for someone from a specific organization. I also want to draw your attention to the resource library. I'm sure slides from this meeting are going to be shared here, as well as the events page, where you can find upcoming events as well as funding opportunities and deadlines in here as well. I'm going to keep today pretty short. I'll share that also our search function at the top or our AI answers function on the left side of your screen here is also a great way to be able to ask questions and get information about what's been shared in the roundtable community here. You can use AI here to ask any question based just in text, like what will be covered at today's kickoff, and I'll be able to answer it based on the information that you have in here. We'll be making sure that the link is in the chat for folks to join, and we're really excited to continue the awesome work from last summer on Roundtable again this summer.
All right. Thank you so much, Emily, for stepping in. And I hope to see everyone on Roundtable. There is a link in the chat to sign up if you haven't yet. And then lastly, we have Eugene for some closing remarks.
Thank you, everyone, for joining us today to align our efforts ahead of the heat season. Even as heat-related death and illnesses decline, our mission remains urgent, right? I'm grateful for our dedicated partners working to ensure that community members do not have to tackle extreme heat alone, which is so important because we are a community and we do need to help and support each other through this. Thanks, everyone, and have a great rest of your day. And I hope you found some of this information useful. Thanks, Jenny.
Thank you, everyone.